Is your patient feeling that every time after they eat a meal, they are concerned with the heartburn that follows shortly after? Maybe they enjoy midnight snacks, go to sleep shortly after, and end up feeling that the bitter, sour taste is just flat out irritating when they awaken the next morning and makes their stomach or chest pain even worse. How about those times that they might enjoy a social distance drink with their Zoom friends during COVID-19? Might they feel that burning sensation that seems to just stick around in their esophagus? Pantoprazole is a proton pump inhibitor indicated for erosive esophagitis associated with GERD, maintenance of healing of erosive esophagitis, and pathologic gastric hypersecretory conditions. It may also help in the treatment of duodenal ulcers associated with H. pylori. Pantoprazole acts by binding to an enzyme in the presence of acid gastric pH, preventing the final transport of hydrogen ions in the gastric lumen. It diminishes accumulation of acid in the gastric lumen with lessened acid reflux. It heals duodenal ulcers and esophagitis, and decreases acid secretion in hypersecretory conditions. IV push methods can be used on adult patients for both GERD as well as gastric hypersecretory conditions. Oral options are also available as well as an oral option for patients 5 or older for GERD. IV is not indicated for children. IV pushes should be administered reconstituted with 10 ml 0.9% sodium chloride. Safe ranges for GERD can be 10 ml over 2 minutes once daily for 7 to 10 days, or 20 ml over 2 minutes for gastric hypersecretory conditions every 12 hours up to 240 milligrams per day. Assessing the patient routinely for epigastric or abdominal pain and for frank or occult blood in stool, MSS, or gastric aspirate is recommended. Take note that abnormal liver function such as an increased AST, ALT, phosphatase, and bilirubin may occur. Administration may also cause hypomagnesemia, and monitoring magnesium levels prior and periodically during therapy is recommended. This especially may occur if treatment is 3 or more months. Other side effects may include headache, cutaneous lupus erythematosus, hyperglycemia, abdominal pain, diarrhea, eructation, flatulence, fundus gland polyps, acute interstitial nephritis, vitamin B12 deficiency, bone fracture, system lupus erythematosus, and CDAD. Monitor bowel function. Diarrhea, abdominal cramping, fever, and bloody stool should be reported to a healthcare professional promptly as a sign of CDAD. This symptom may begin up to several weeks following cessation of therapy. This medication can interact with other drugs such as atazanavir, nelfinavir, drugs requiring acid pH absorption such as ketoconazole, itraconazole, ampicillin esters, iron salts, erlotinib, mycophenolate mofetil, warfarin, digoxin, and methotrexate. Y-site incompatibility includes incompatibilities with pantoprazole should not be combined without a flush. Teach the patient that this medication should be taken as directed for the full course of therapy, even if feeling better. They should be reminded of avoiding alcohol products containing aspirin or NSAIDs and foods that may cause an increase in GI irritation. Tell patients to report onset of black, tarry stools, diarrhea, or abdominal pain to healthcare professionals promptly, and should rash, diarrhea, abdominal cramping, fever, or bloody stools occur, do not treat with antidiarrheals without consulting healthcare professional. Patients should notify healthcare professionals of all RX or OTC medications, vitamins, or herbal products being taken, and consult healthcare professionals before taking any new medications. Females of reproductive potential should notify healthcare professionals if pregnant, a planned pregnancy is suspected, or if breastfeeding. An evaluation of pantoprazole should resolve with a decrease in abdominal pain, heartburn, gastric irritation, and bleeding in patients with GERD. This may require up to 4 weeks of therapy. Erosive esophagitis should heal within patients. Therapy is continued for up to 8 weeks. Start feeling new today.
Heartburn, sour taste, late night snacks. All you need is pantoprazole. All you need is pantoprazole.